Today we're going to talk about something a little different, something very more basic within at least the field of rheumatology, but certainly a lot of people suffer from, which is something called tendonitis. So tendonitis is when something occurs to cause pain to a tendon in your body. Essentially, it's pain that we feel that brings it to our attention. A tendon is tissue which helps connect your muscle to your bone. So it's really the very, very end of a muscle and attaches to the bone. And we all have tendons all throughout our body. Common areas that we think about: shoulders, elbows, hips, knees, hands, feet. Basically, if you have a muscle, the muscle has to have a tendon, and it's there. Tendonitis often occurs because we've irritated in some way the tendon. And this can be because we had a sudden injury, so you know you did this, and since then it hurts. It can be because of overuse, so you've used that muscle or tendon too often in a way that just wasn't good for your body. And sometimes it hurts and we aren't able to say why exactly that happened. In most cases with tendonitis, it improves on its own, and that may be over hours, days, weeks. Sometimes it needs a little bit of help, and there are things we can do to help it settle down. So common being common: ice at the time of injury, bracing, and there's all sorts of different braces and things that you can wear over an area to kind of limit its using it just so it can settle, although that's maybe not a great long-term solution. Pain control, so of course trying to manage to limit the pain that's having, and lots of different ways to bring pain under better control with medications and non-medications, really beyond what we'll talk about here. And really to emphasize, physiotherapy can be very, very helpful in this regard. Tendonitis sometimes can feel like it's not actually the tendon problem, but actually feels like it's a joint problem, feels like it's arthritis. And that's often where rheumatologists are getting involved, because we see folks who feel like they may have arthritis, and we actually find that they have a tendonitis instead. And this makes sense, though, because there are many tendons around joints. Muscles, really their purpose is to move our bones, move those joints. So we need the muscles to be around those joints. To be clear, though, tendonitis is not a joint problem. Tendonitis, the tendons are around the joint, so it'll feel like the joint, but the joint itself usually is okay. And your physician, your rheumatologist, can usually determine the difference between tendonitis and arthritis simply by listening to your symptoms, how you describe them, and doing a good physical exam. Often that is enough. Sometimes some extra tests may be necessary. Just to be clear though, itis, so at the end of tendonitis, usually that means inflammation. But when it comes to tendonitis, while certainly it's possible to have inflammation in that area, that's not necessarily true, and it's more of a historical term at this point. It often actually can be more of an irritation to the area as opposed to inflammation. And certainly if there is inflammation, it is not the same inflammation as you would see in autoimmune inflammatory disease, such as rheumatoid arthritis or other more common rheumatic conditions that we see in rheumatology. When I say more common in rheumatology. Tendonitis is certainly much more common than the vast majority of diseases that we see in day-to-day rheumatology, much more common than autoimmune inflammatory diseases. So some common examples, terms that you may have heard of: so rotator cuff tendonitis around the shoulder, a tennis elbow or golfer's elbow, obviously at the elbow, a term called trochanteric bursitis. There is some bursa involvement, but also tendons in that area, so it's kind of the lateral part of the hip, and patellofemoral syndrome, which is some of the tendons that go around the knee. Proper physiotherapy with an emphasis on stretching, strengthening, and range of motion is a key part of treatment. In other words, to see a physiotherapist, they teach you things that you can do, and then you can go home and work on those stretches, strengthening, range of motion exercises on a daily basis, and over time, they can be extremely effective at resolving the issue. We strongly recommend physiotherapists for this, but if you need some beginning exercises where physiotherapists have provided some input, feel free to visit our webpage. You can find it under the diseases tab and then under the regional MSK disorders. And we have about half a dozen common types of tendonitis that we list there with some exercises to get you going. But they really only get you going. Then good to see a physiotherapist so they can add to that and really work at making that better for you. As always, our website has all the information on that or any other rheumatic disease. Please feel free to visit us at albertarheumatology.com.